we have a very, very special guest today. What's cool about these Q&As is that we get to talk to all different types of people in, the professional medical world, doctors, PTs, chiros. Today, we have someone who's doing it at the highest level in the sports world. We've got Mark McCracken, who's the assistant head athletic trainer for the Washington Commanders. If you guys have been football fans this season, you guys know what an astronomical season the Washington Commanders had this year. Very exciting to watch. So I just want to say, Mark, welcome. Thanks for being on with us today.
Thank you. Glad to be here.
Congratulations on really like a historic season. I mean, I'm a fan myself, and to see what you guys accomplished this year as a team, as an organization, was pretty remarkable.
It was a fun ride and it's a long time coming. We're hoping to build on it next year.
Absolutely, with the help of StemWave too. Yeah, before we jump into all like the fun StemWave stuff and how the Commanders are using it, just give everyone a little bit of a history lesson on who you are, kind of like where you come from training wise, and kind of what brought you into the NFL.
Absolutely. So a little bit about myself. My undergrad experience, I got my bachelor's in athletic training from George Mason University in 2011. And during that time, I was actually a student athletic trainer with the then Washington Redskins. I was the first student athletic trainer from my university to get a clinical rotation with the team, with any NFL team. That was in 2011. In 2012, I went and did an internship with the Arizona Cardinals, and from there, I got the desire to go and get my master's degree. I went to LSU. I got my master's in kinesiology. So I was down in Baton Rouge for 2 years, and right after that, I was lucky enough to find a position back here with again the Washington Redskins in 2015, and I've been full time since. So I've bounced around the NFL quite a bit. I went tried out college when I was down there for grad school, and I'm fortunate. This is actually my hometown, so I'm fortunate to be working for my hometown team.
That's amazing. Yeah. Now, correct me if I'm wrong. Are you the longest tenured trainer on the staff for Washington?
Second longest.
Second
Second
longest. Okay,
longest.
that's
Yeah.
pretty amazing.
My coworker has been here for I think a year or two longer than me. And other than that, there has been, with coaching changes and ownership changes, there's changes amongst the staff, coaching staff and front office and everything like that. So fortunate to have made it through all of those changes and to finally see things coming together here. And we're putting things together and having a good time with it.
I think that's a testament that you know what you're doing. But you
Thank you.
definitely, have this amazing history with sports medicine, being in different teams and in college and all that kind of stuff. What is kind of like the most common thing that you're seeing in the training room these days, like in regard to both chronic and acute musculoskeletal conditions? Like what's like the common ailments that come through the door?
So a lot of it's sort of seasonal. Like every few years, the theme changes, right? There might be an emphasis on ACLs one year, and then another year it might be an emphasis on soft tissue injuries, hamstring, groin, quad, and then another year might be concussions. So there is sort of an ebb and flow of what's the hot injury at that time. Right now, it's injury prevention. That's a big one. So you see that a lot in the NBA where they're doing, workload management, things like that. The NFL is now adopting it, and I can say that our team, we're doing our best to adopt that as well in terms of, what certain injuries certain players might have, and it's risk mitigation, right? The goal is to win football games on Sundays, and so we do what we can to reduce the likelihood of injuries. And then if someone does have an injury, it's obviously the goal is to get them back healthy as quick as possible. But then what happens after that? Do we maintain them? Do we keep, our players on a preventative or any type of maintenance program? And just anything that we can do to, get our players on the field when we need them the most.
Absolutely. So what have you kind of played with over the years as far as like other different types of modalities before StemWave came into the building? What were kind of the things that you guys would see a lot of in the training room?
Yeah, we're fortunate. We have pretty much everything at our disposal, for the most part. Or at least we've had experience with most things. So in terms of modalities, you have everything from e-stim, ultrasound, any kind of hot cold therapy, vibration and pneumatic compression devices. Those are big. We've had a different, you know, different types of shockwave devices before. Bringing in the StemWave was huge for us. Um, and then you also have recovery modalities, right? You have you know, saunas, and we have sensory deprivation float tanks and cryo chambers. So we have all of these different modalities, and the key is like how do you use them, right? Because you can use like a shotgun approach, and you just throw everything at the athlete, and you see what works, or you can kind of have a more systemic approach to it. Um, and that's kind of what we follow as well.
So I think that's really great to know, like you have everything at your disposal. You mentioned StemWave. Let's jump into that a little bit. Can you walk us through how you guys over the Commanders have integrated StemWave into your training this past season?
Yeah, absolutely. So, after we got in touch with you and we decided, okay, this is something we want to look at. Uh, it was sort of like a vetting process, right? We wanted to see, what type of information can we find on StemWave? What research information can we find on StemWave? And and we found a lot. You guys were able to provide myself and my coworkers a ton of research evidence that shows the benefits of it, and then once we made the decision, okay, let's try this thing out. When we had our in service, we did a full training session, full educational session. So it was a sit down, get your notepads out, let's learn, let's talk, let's ask some questions. And then it was a hands-on portion where we were able to, learn how to appropriately use the device. And from there, now it's up to us as practitioners to determine when and how and who to use this device on. And so, one of the biggest things for us determining what works, right? We can say, okay, this works for X, Y, and Z, and we like to use this for A, B, and C. When we have players who will, specifically request a certain modality, that to us is like, okay, this thing's working, right? So now we have players that come in and will request StemWave, and they'll say, hey, I need to, get the shock wave going, and we make sure to program it, as how we see fit, and make sure that we're doing the right thing for the athlete. And but again, if a guy's coming in and requesting a certain modality, I think we're on to something good.
That's amazing. And you touched on something really important too. The fact that, well, first of all, it was, last summer, you and I were having a conversation on Zoom, very much like this, where we're, touring about the idea of getting StemWave into the Commanders. And I actually had the privilege of flying out and being there for the training. We had Dr. Madison, our lead clinical advisor, come out and train. And it's a very, well-rounded training where there's the informational section, like you were talking about, where, we're showing studies, we're showing data, and then it's hands-on where you guys get to actually do treatments on yourselves, on each other, and then obviously on the players. It's the same thing for everybody that's tuning in. It's the same thing for when you become a StemWave provider. You go to a group training. Now, it's not the same where we fly to you, but we have group trainings now all over the country. So whatever one's closest to you, and you get that real hands-on experience where you get one of our clinical advisors that brings you through all of the data, all the science, and then you get to test it out on yourselves, feel how it actually works on your own bodies, so you know kind of how your patients are going to react to it as well. That was a really fun day. I had a great time being, at the facility and having you show us around and getting to see you guys, all be hands-on with it. And I know you got to try it on some old injuries that, you had some issues with over the years to see if you
Yeah.
can get some relief. And I remember we opened a lot of eyes that day with the instant kind of result that people kind of feel, that instant pain relief, that instant new range of mobility. And it was pretty cool to see, a bunch of people who do this at the highest level having that light bulb turn on, like, oh wow, this is actually like right off the bat doing something. So like what kind of, obviously you don't have to, give players names or anything like that, but like what kind of injuries have you found StemWave to be particularly effective with this past season?
Yeah, so it's a wide variety, right? So we see everything from bumps and bruises to minor sprains and strains to, broken bones and surgical interventions. So, but the majority of what we have is sort of nagging injuries that are bothering a guy, sort of that acute on chronic, um, uh, yeah, like an acute on chronic situation, something that's been here for a while, but it hasn't been years, and we just need to work through these sort of difficult times again to get them ready for Sunday. So we kind of have a different approach, not being in a clinical setting where it's like I have multiple weeks to get someone to achieve a certain milestone. We get 6 or 7 days. So some of the things we've worked on, it's the issues that are hard to reach. So with other modalities, whether it be instrument assisted tools, sometimes you can't get quite deep enough. If you're working any type of stretching technique, sometimes these guys get pretty big, and it's difficult to work on that. Corrective exercises has its place as well, but sometimes you need something that kind of gets to the deeper level of the tissues. And, StemWave does that for us. Even for older chronic injuries, uh, it can help just improve some of the range of motion that guys didn't have. It can decrease pain levels. You mentioned the anecdotal stuff. Okay, we were using it on ourselves. I was using it on myself yesterday. I had some plantar fascia and I was dealing with some plantar fasciitis. They had 2 treatments, and I just told my coworker this morning, I was like, I don't notice it today. And this is before this Zoom even started. I did a treatment on Monday. I missed Wednesday. I forgot. And then I did again today, or excuse me, yesterday. And, I feel great. And, so the benefits are there. Again, the players are seeing it, and the wide range of things that we can treat, soft tissue injuries, um, any ligament, tendon injuries. Again, and even we can use it for post-operative cases as we see fit as well.
That's awesome. I love that you get to just go in whenever you got something bothering you, just like, oh, I'm gonna do a stem wave on this. No, it's like
Yeah,
a secret weapon almost.
yeah,
You mentioned before, I love hearing this, that now players are coming in and they're specifically saying like, hey, can I get that stem wave on X, Y,
yep.
and Z? Could you give us some other kind of insight into some other feedback that the players have been saying about getting the stem wave treatment since you've had it now?
Yeah. So I mean, that really is like the biggest point to me is if guys are specifically requesting it, again, that is pivotal to us. We're like, okay, this is something that works. So, some of the things that they're dealing with, right? So we program it into there. Everyone has an individual program that they have, whether it be again from a post-op case to, something that's just bothering them week to week, day to day. So we get it in there and we systematically use it appropriately. So when we're using it on, a professional athlete, you have to keep in mind, they've had all of the specialists, they've seen all of the, fancy modalities all around. So having something new and having something unique that they either haven't seen before or haven't been exposed to before, that also plays a role in it too. So the cool factor of it, right? That can't go unannounced, right? So when we have all the modalities that you can think of, and they've seen and they've used all these modalities, and so they know how their bodies respond to them. But for us to have something unique and have something new, cutting edge, for us, that is a game changer in and of itself, right there. So yeah, a guy's coming in and he's requesting it. Absolutely. Now we just make sure that we use it appropriately. I will say, their pain tolerance, right? Because when you're using the device, you're going to have that sort of a dull, achy feeling, and that's what you're looking for. We just have to make sure we're using the protocols correctly because their pain tolerances are much higher, than mine is when I was using it on my foot.
Yeah. And I remember even when I was there for the training, there was a lot of players as we were testing out the device, all of your staff was using it on each other. some players would walk by, even, really large linemen would
Yep.
walk by and they kind of see it and they'd be like curious, but then,
Yep.
they kind of hear it as well and be like, oh, what is that? I've never
Yeah.
heard
That's
that
the
before.
cool factor that they're, that, that comes into play as well.
Yeah. And I also, remember one of the things that everyone was excited about when we brought StemWave into the Commanders was, like you mentioned earlier, it's not just like treating these acute injuries, but it's also preventative. And there was this idea that if the franchise could keep a player who was a veteran player and kind of the longevity of their career could expand by another 2, 3 years, that would be invaluable. Have you seen that to be the case with some of the older players this past season?
I think we've done a good job of incorporating everyone into it, right? So the older players, the younger players. I think our time lost due to injury this year in the NFL was the lowest. Um, and so that's phenomenal. So that's, a credit to not just StemWave, but to all of us, as a staff and how we work systematically and approach these injuries. But absolutely, it's a game of who's available, right? Your best ability is your availability. So keeping these guys on the field, whether it be day to day, week to week, year to year, that's something that we don't take lightly, and we understand that that is what's going to save jobs essentially in our field.
Yeah, I actually want to commend you. I mentioned this to, some of the guys here at StemWave throughout the season. Like, the Washington Commanders did an amazing job of staying healthy this year, and that's a testament to you and your staff. Obviously, on the side, I was kind of like saying, like, yeah, StemWay's helping that. I'd like to think so, but you guys really did keep everybody as healthy as possible. I mean, having some guys come back with injuries that everyone thought was going to be season ending, and then to be able to have them available for the playoffs. So it's just really great to see that your whole staff is really making that effort and keeping everyone healthy. So what would be kind of like a typical week in the training room of using StemWave with the players? Is it more preventative during the season, or is it more like rehab?
It's more of like a treatment rehab approach. Um, and what happens is after a guy, let's say a guy is injured. So we're going to use that during the rehab, the treatment process of getting them back healthy. And then we're going to keep them on a maintenance program. So if a guy has anything, let's just say an ankle sprain, and he's running through a situation where, okay, he can't quite practice yet. Our goal is to get him to play. We're going to use, all of our techniques and including the stem wave on this rehab process, and then they play on Sunday. Well, it's not over yet. That ankle is still going to bother him, right? That hamstring is still going to bother them, whatever it may be. So now we create, one thing that I would like to do is create a individualized, program for the guys. So we'll use it in a regimented manner like that. Um, and that's the key, I think, to keeping these guys healthy and on the field is not just what you do, it's how you do it, and are you using it appropriately? And I think that's where the training that we had kicked back in is, we had substantial training with the STEM wave, so we knew, okay, what are the protocols, how many times, what's the intensity that we want to take this thing up to. I even typed up a nice little sheet. I put it on top of the unit and it said, okay, these are the body parts, these are the conditions. This is your intensity. This is how long you want to do it, how many clicks, and so that way our entire staff is able to use the device appropriately, and it's been beneficial.
Yeah, that's amazing. Staying in contact with us throughout the season was like big. I know, you were able to reach out to Dr. Madison for some things. You and I stayed in contact. You were in contact with our team. If there was any issues that came up with the device or any questions, give people an idea of what it was kind of like responsiveness to work with everyone here at StemWave.
It was awesome. I mean, it was first class. It really was. Having the access to Dr. Madison, I would just cold call him, and he's a very busy guy. So, if we weren't able to get in touch right away, he'd text me right back and say, hey, I'm going to call you in 5 minutes. We were able to talk through, specific cases that we might have questions on. Um, and we ended up using the device quite a bit more than maybe we had anticipated. And so we needed some more equipment and, reaching out to you, reaching out to the IT department that you guys have, getting any type of advice or help or, hey, we have, questions about this. The response time is phenomenal. You guys were very helpful and easily accessible. It did not feel like we were left alone. When the device was dropped off and the bubble wrap's taken off, um, it was we were not alone in this, in that if there was any questions or anything like that would come up, it was truly first class service.
Well, thank you. Appreciate that. Yeah, we pride ourselves on that. And for anybody who's on this call that is, curious about being a StemWave provider, just know that when you become a StemWave provider, you have a dedicated account manager and you have access to coaching calls, trainings. We have a whole library full of things that will help you market your device, any questions you have, technical things. 24/7, we're here with the website, with our training zone school. And like I said, you have that dedicated account manager that, holds your hand through the whole process because, we have the training in person. And even after that, there's people still have question marks about like, how do I actually get this rolled into what we do at our clinic? So we're there every step of the way to help you. Like I said, even with marketing the device. I want to also say that, we're going to get to a Q&A section in a little bit towards the end of this. So if anybody has any questions for Mark, feel free, throw them in the chat and we'll get to those at the end of the Zoom. But I did want to find out, Mark, so, we partner with, colleges, you guys in the NFL. If you were to talk to other training staffs around the league or in other professional sports, what would you kind of say to recommend StemWave?
So I'd ask them, what they're doing currently, what modalities are they using, and what do they feel like they're missing, right? And then that can kind of help me point them in the right direction. That can kind of help me uh, show them, okay, guys, there's something else here. And the modality of shockwave is relatively new, right? It's been around a while, so but a lot of people either don't understand it, to be honest with you, or they don't have the correct device or the correct education on it. And that comes with StemWave. So you're going to get the education. You're going to get the information in terms of the research backing behind it. Um, and this is something that I think as a professional athletic trainer, if you're looking to provide the best service for your athlete or your patient, this is it. This is one of those things you always look for. Okay, what is the next step? What is the cutting edge thing that I can get? What is something that truly works? And this is it.
Yeah, I think that was such a great pairing when we first were talking because I know that everyone in your building, especially this season with new ownership and all that kind of stuff, you guys were looking to really take it up another level and offer the players. And you even said this yourself to me. You said we want to offer them the best in every category, the best coaches, the best trainers, the best modalities, the best facility. We want to give it to them, this year, especially moving forward. And that's why it was so exciting to get StemWave in, especially for this season, and to see how far you guys were able to go. And I feel like you're just going to keep on building off of that. I am curious, did you notice any trends in recovery times for players this year using StemWave versus maybe some other treatment methods you've used in the past?
Well, I think the numbers speak for themselves. I think the fact that we were, in the NFL, I think we were the lowest or one of the lowest in terms of time lost to injury. Um, so I think that is a testament to everything that we do here for the athletes. And then again, when we have a situation, we have a modality like StemWave where a guy is intentionally coming to receive treatment for it, that tells you they are responding well to it. So it's not just, again, that they're looking for, that, again, that cool treatment or something different. It is something that is beneficial for them. And I think if we're keeping guys on the field and we're keeping them healthy and we're able to reduce time loss, we're able to prevent injury, and we have a device that can do that, um, that's something that we're going to use and be thoughtful and cognizant of. And uh, it's been a blessing for us.
Every time I would watch one of the games and I'd see you on the sidelines, I'm like, and then someone would get hurt. Maybe you're running out on the field, and I would just think like, they'll be fine. They're gonna get StemWave. Mark's gonna do StemWave on them. It's gonna be fine. They'll be back in a couple of weeks. Don't worry about it. I was almost wishing that we would see the device on the sidelines. I don't know.
Yeah.
Are there rules against that in the NFL of having medical devices on the sidelines?
There are certain rules about what is on the sideline, and certain companies have, I guess, sideline privileges on what is marketed on there. So we do have to be cognizant of that. Uh, but yeah, it would be difficult to have that on the sideline, but whatever it takes, right?
That's whatever. I know. It's like I imagine like there's a time in the future where you're able to have like an away game StemWave and that home game StemWave and just be able to treat players wherever you may be.
Yeah. And when teams travel, right? If there's a substantial travel time, whether it be international or if we go West Coast, we're going for 2 days at a time, and sometimes there's joint practices where you might travel for an extended period of time. We bring a substantial amount of equipment with us. It's a when a team goes on the road, it's a traveling show. Like we bring a lot of stuff with us. So always want to make sure again, like we are providing the best care for our athletes at all times.
Yeah, I think even this past season, because of the schedule, you guys ended up staying the week in Arizona, right?
We did. We went out to Arizona for I think it was nearly a week. Right after our Monday night game, we flew out to Arizona, stayed out there for a week, and then played the Cardinals. And that was a good time. That was a good experience. Kind of bring the team together, and it was early on in the season, so it was a good time.
Yeah, so I guess like thinking about that, you definitely don't want to be there for that long without your key, modalities and components. Like, you still got to treat the players. They're still going through their weekly programs, right?
Absolutely, yeah. So logistically, planning that out. Normally, games you're on the road for 36 hours, and now we're looking out. We were on the road for 8 days, and for football, that's sort of abnormal, right? Maybe basketball, they travel, they have a 3 game series somewhere. Um, baseball as well, but football, that's actually one of the best things about working with an NFL team is while we're busy all the time, our travel usually is pretty light, but my wife appreciates that.
Yeah, I bet. So we were talking last summer before training camp started, and it was actually like a great time because we were able to get it in during like the end of mini camp, and then before training camp, you guys were equipped with StemWave. What did you kind of see as far as like players starting to come around to adopting it from training camp into the season? Like, what was the turning point, do you think, for a lot of players to start going like, oh, I think I need that?
I think it's all word of mouth, right? So that experience that you mentioned when we were doing our training in-house on that first day, you see some guys kind of walking by, they're eyeing it, they're going to ask questions. And then player A receives treatment, and player B sees that and he asks what's going on, and then there's talk that might go on outside of the training room of hey, I use this device, and they got this in there, they can use this on you. So the word of mouth is definitely playing a factor in it. And then again, if guys aren't going to see if they're not seeing benefits, they're not going to do it. And that goes across the board for anything. If we have them do, again, corrective exercises, and they're not seeing the benefits of it, and they're like, I don't have time for this, or blah, blah, whatever it may be. We have to pivot, and we have to think of something different that's going to work for them. And every injury is different. Every player is different. So when you see, again, the guys are talking about it, that tells you we're doing something right here.
Yeah, I remember even when we were there doing the training, we had the former president, Jason Wright, come down. He had some old football injuries, and we were doing treatments on him, and he was flexing his arm and saying, like, I haven't been able to move this since college. And all the players that were getting other treatments started to like perk up and look like, oh wow, maybe that's something I should look into. And I was like, okay, I think this is gonna go well in this training room.
Yep.
So I'm going to take some questions from some people that have been thrown in the chat now. So if anybody has questions for Mark, throw it in the chat. The first one is, how often during the week do the athletes receive treatments? Is it one, two, or more?
Well, treatment in general, it's multiple times a day. So,
I
you
think
know,
StemWave specific. I think that's
specifically
yeah.
StemWave. Okay. So specifically StemWave, the learning that the education that we got is, hey, we're going to use this every other day, um, for a specific case. So, um, we'll go Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday, whatever it may be. Whenever the issue arises, we'll try and space it out, every other day. I did talk with Dr. Madison, and say, hey, I have a case where, you have limited time. What is your suggestion if I were to do this every day? And he was able to, so that's an example of, he was able to walk me through, okay, let's lower the dosage, lower the clicks. He's not having any type of painful response to it. As long as the intensity is not too high, we can try this approach. And so he was very helpful with that. But for the most part, we try and space it out every other day. And it is a modality that we like to sort of finish on. That's one thing that, you know, we typically incorporate is, okay, we're gonna, our treatment in the morning is we have, our prep for practice. After practice, it's going to be some recovery, some feel good stuff. And at the end of the day, okay, we can either send them home with a device, or we can, do shockwave here, and that'll be like sort of the last, the icing on the cake.
Yeah, I think even when I was there too, we were talking about that, making sure we finish with StemWave. And much like working out, this was kind of like the analogy that even Dr. Madison was talking about. You got to give the body time to recover. So even though we're not creating damage in the body, we still want to give the body time to, heal, recover, feel better. So to do it every day wouldn't be a good idea. But I think, like you said, the every other day to answer this question makes sense, especially on these kind of high caliber athletes.
And that's the hard part too, is, if a guy is responding well to it, the old saying, well, more is more. Well, not all the time. That's what I was getting to in saying that, we have to make sure as practitioners that we're using the device correctly within the correct parameters. Um, and it's tough because it's exciting. Like, you're going to see results, and you're like, okay, well, we have to use it. If we have to space it out, that's what we got to do. Um, and you have to trust that, you know, in time you're gonna see positive results, and that time is probably going to be quicker than you think.
Yeah, and I remember too, one of the other things that we were talking about when we were there was, these are large human beings,
Yeah.
and their pain tolerance is much different than most people's. It doesn't mean that we should crank up the stem wave unit and make it to a point where they're wincing, because it's not about that. We don't actually want to hurt anybody or make them feel pain. It should be at like a level 4 or 5 pain when they're getting their treatment done. So have you found that to be something that you have to constantly like
Oh
work
yeah.
with the players on, is remind
Oh yeah.
them
Oh yeah.
you're
Oh yeah.
tough? Yeah.
You have the um, you put the saltwater concentration in there, and then you have the if I'm using the wrong word, I think the spark plug, right? You got that in there.
The electrode,
So
yeah.
the electrode, and initially we were kind of running through those quicker than we might think, and it could be of multiple reasons. One, we're using the device a lot, right? Or two, these guys' pain tolerance is so high that we're like, okay, if they're not feeling it, we have to turn it up. So that's where we kind of had a sit down amongst each other and said, okay, are we using this device correctly, right? And that's when I would call Dr. Madison and say, hey, I'm taking this thing up to, whatever intensity it may be. And he's like, okay, so let's dial that back a little bit and make sure we're using it, like, correctly. But again, their pain tolerances, it really is unique. I was using it on my foot. I think I had the intensity 0.05. I
Right.
started at 0.08. I had to bump it down. I got 2 clicks out and I had to bump it down. Like, it's totally different. If anyone has experience working with professional athletes, it is a totally different patient population that you're dealing with.
Yeah, I know. It's like you're at point. I mean, I've done it on, for many different injuries for myself too. And yeah, I don't ever go anywhere near like a one. It's always like a point oh, point
Yeah.
something. So I can only imagine that these guys that are used to just being in, like car accidents every day, with hitting each other on the field, like that's nothing for them.
No, it's impressive.
One of the next questions was, after pain has subsided from several stem wave sessions, are you seeing reoccurrence of pain after you stop treatments?
No. And the reason is, again, let's say pain has subsided after a couple treatments. We're probably going to keep them on a maintenance program. And that is the injury prevention aspect of StemWave, but that's the injury prevention aspect of, how we like to approach, the game of football as well. So, um, if someone said, oh, let's say we do two treatments and they're like, I'm good, um, we're going to encourage them to continue with prehab or any type of preventative maintenance program, and whether that is using other devices that we have and corrective exercises that we may have, and sort of a prep routine before games, before practice. Um, but it's not something that okay, we've cured it. Now we can just stop and go hands off, because that's how something sort of reoccurs. So, it's if someone is seeing benefits from it, from StemWave, and we like the way it's working, we're gonna keep it in their maintenance program.
Yeah, that's beautifully said, and I think it's good to mention. You touched on this, that STEM wave is not the end all be all. Like, it is a very fantastic, powerful modality. But we even said this when we were there at the training. It works with the other things that you're already doing for your athletes. It works with, like, if you had an athlete that was coming off of an ACL surgery or something, you wouldn't just stem wave them and then put them back on the field. Like, stem wave them to get the tissue healed, but then you have to do all the other rehab work to get the brain talking to the body and get
Right.
them moving the right way and all that stuff. So, being able to use the other modalities, the other techniques, is super important in conjunction with stem wave.
I agree.
Okay, next question. How soon after competition or injury would you utilize stem wave?
We've used it the next day. That's simply put, we've used it the next day. So, and again, it depends on the patient, right? So we're going to say, okay, or the athlete rather. Um, if a guy we know has a little bit higher tolerance to an aggressive rehab, okay, we might be able to use this the next day. And if not, if we do use it, we're going to have to lower the intensity. Um, but yeah, we've used it immediately afterwards. We've used it for acute conditions. We've used it for chronic conditions that haven't received any treatment. Um, and we're going to see results with that. And so, and it sort of gives us our own diagnostic experience. Okay, with an acute injury, this is how we've seen it respond. With a chronic injury, this is how we've seen it respond. With a more superficial injury, this is how we see a deeper injury. So now, when something similar pops up, it gives us better ideas of like the parameters of how to use it. But certainly immediately afterwards, yeah, definitely.
Yeah, and I think just knowing that it doesn't create damage. Like, this is a non-destructive tool.
Correct.
You know that if you have a player coming back, even after surgery,
Yeah,
like right away, get the healing started right away. That's fantastic. Have you ever used it in conjunction with low-level laser therapy to complement recovery?
absolutely. So we have a couple laser devices um, that are they're class 4 lasers, so they're pretty high, intensity. We get up to I believe 40 watts, and so we can use them. That's something that we use. Again, that's another device we use daily, um, and we'll typically use the laser at the beginning, especially if it's going to have a thermal, as a class 4 laser is going to have a thermal element to it, so it's going to warm up the tissue. We're going to use that. Then we'll get hands on whatever we have to do. Um, but we definitely use the stem wave in conjunction with other modalities and other tools and corrective exercises that we have.
Yeah, and we hear that a lot. Like, this kind of touches on what we just said, like using stem wave as a supplement with other modalities. The goal is to get the athlete, or in, most cases, the patient better. So, whatever works, you go with that. And we already know that, StemWave does such a great job with range of motion, pain relief right off the bat, and then to pair it with anything else that you're currently using is just a home run. Have you ever had any success with damaged nerves? I guess this is like traditionally like the stingers that we see when guys get.
Yeah.
I don't know if you've ever been able to use it this season on any nerve problems.
So have not used it on a stinger. Have not used it this year. In terms of damaged nerves, we have not had anybody with that type of condition, right? And when yeah, cross your fingers. Throughout my career, we have had players with nerve damage. We did not have the stem wave then, so I was not able to, give you a definitive, hey, did this work on a damaged nerve? Um, but that is something that maybe in a clinical setting, maybe you'd see more often. Um, but unfortunately, I haven't specifically used it on any nerve related issues.
Yeah, and I think if people are curious about, how it works with nerves, and I mean, first off, like, so thankful that you guys didn't have to deal with any major nerve issues with any players this season. That's great. But we partnered with a clinic called Project Walk Boston. If you go to our YouTube page, you can watch some videos on it, and they are strictly spinal cord injury patients, and they have seen pretty incredible results with their patients through the nerve damage, through pain relief in the nerves and gaining strength back and all that kind of stuff. So it does leave me hopeful that, heaven forbid you guys have a player in the future that has some sort of nerve injury, that StemWave will definitely be there to help relieve the pain and hopefully get their strength back very quickly. How often are you using StemWave for the maintenance protocol after that they reach the return to play? Is it like once a week, or like what's kind of the pacing for that?
Yeah, so again, we're going to stick to that every other day protocol. So it'll be 2 or 3 times a week that we're going to use, and on the days that we don't use it, we'll use another modality. And the way I like to do it is, some days are going to be a little bit more aggressive of a rehab, depending on how maybe easy their day would be otherwise. And if they have a more difficult day in terms of like a heavy practice load or a heavy lift or anything like that, then the modality of choice will be a little lighter. In terms of like the tissue disruption that'll be going on will be more of like a recovery based approach there. But in terms of like a maintenance idea, again, that's going to be 2 or 3 times a week.
That makes sense. Yeah. Someone's asking if there's a physician guided standing order for you. So I'll just say that, we have treatment protocols that are always evolving. We constantly get more data and feedback on, how people respond to it and what the science says. There's a bunch of studies done on it. So Dr. Manison's our lead clinical advisor. He kind of works with the other clinical advisors, and they set all of the protocol standards. We have everyone from PTs, chiropractors, MDs, all weighing in on, what the science is showing, what they're experiencing in person with their patients. So we do have a standardized kind of protocol that we all follow. But like Mark was also saying, when you're in the field and you're using it, you have to kind of adapt to what, in his case, your players are reacting to, and compare that with the protocols and just find the best use for those situations. How effective is it for disc issues and spinal compression? Have you had any of these this season?
Yeah, so we're gonna see that, just in terms of a contact sport. That's another one that we're gonna see benefits for. So the key is, if we have someone with any type of radiculopathy, we're probably going to intervene in a medical sense more quickly than in a I guess in a standard clinical setting. But we're going to have guys with low back spasms, and that could be due to any type of disc related issue there. Maybe they have some sort of a facet issue as well. But for low back, we absolutely use it. I think that was one of the first areas that we used it on, and we definitely see results with that as well.
Yeah, it makes sense in football that you're probably going to see some spinal compression stuff.
Yeah, it's
And run head first.
yeah,
Yeah.
heavy contact sport.
Yeah. Someone's asking if there's a way to get a copy of the protocols. Yeah. So when you become a StemWave provider, you are provided with all of that. Even during the trainings, even if you aren't a provider yet and you want to go to a group training just to see what it's all about, more than welcome to. We have a lot of people that do that at the trainings. Everything you go over everything and you're provided with a binder. Mark's whole staff, they have binders that have all the protocols, all the information about, the best practices and how to use the device. What clinical settings have you decided to avoid using the technology?
So an interesting one here is we were using on sort of upper trap thoracic area, and again the device does have an audible click to it. So something that practitioner can use on your own. If you're doing that, sometimes they can be a little loud for the patient, right? So just put earplugs in, or maybe have a towel over their head, just to provide patient comfort, patient positioning. But those are all the things that you learn, doing it in the field, right? You're going to see, okay, in a more superficial area, it's going to feel like this. Over a bony prominence, it's going to feel like this. And so, and you can, that's something we learned in our training is, while you're using the device, there is sort of an audible, almost a tactile feedback that you're going to have when you're over an area of concern. So, um, but again, if you're doing around, I guess, the ear, anything around upper cervical trap, anything like that. Um, that's one area. That's one thing we saw. We're not going to use it personally over an open wound. We're going to let that thing heal. We just want to make sure that we're not bothering the natural healing process of that. But as soon as incisions come out or sutures come out, or these guys are going to get some kind of turf burns and things like that. You just want to, make sure we're not using over that. But um, other than that, that's the I wouldn't say we're avoiding that. It's just something. It's sort of a precaution that we take when using it.
Yeah, see, this is perfect feedback. So now you've got my gears turning. As the chief brand officer of StemWave, I'm thinking now maybe we include with the StemWave device some StemWave branded earplugs for when you have
Yeah.
to work on somebody's neck area or the, like I said, the cervical area or trap.
Yeah.
That's fantastic. Cool. So we're going to be wrapping up in a minute. I have one kind of my own personal question for Mark. You talked about when we first started this call about how you use it on your foot earlier, and it was just like pain went away. Obviously, without getting into specifics of player names or anything like that, can you share maybe a little anecdote from the season of something that surprised you that StemWave was able to do with a player?
Yeah, so that's the tricky part. I gotta keep the patient privacy.
Yeah, for sure.
Um, sure. We had a player who had a lower extremity injury that was nagging. Trying, we're trying medicine. We're trying intervention with modalities. We're trying, uh, soft tissue corrections, and one of the things that we found benefit was StemWave. And that was sort of the pivotal thing that he continues to use is this is what works for me. We're going to have his prep routine, but he knows he's almost doing that to appease us because he knows at the end of the day he's going to be able to get his stem wave treatment. Um, so unfortunately, I can't give the specific details of who and what it is, but I can promise you that we are seeing specific results with specific injuries for a ton of players. And my personal anecdote is, you know, I've I'm training for a marathon, right? So I'm getting all kinds of new injuries that I've never had before. IT band syndrome, my lateral meniscus is flaring up, got plantar fasciitis. I've never had any of those issues before. Never been a runner before. I am seeing like almost immediate results on myself for these variety of things. Now, of course, I'm using, I'm foam rolling, right? I'm doing the corrective exercises that I need to do. But that example that I just gave you about that plantar fasciitis, that was 2 treatments, and I'm good to go. So I can tell you there are specific examples. like that we see, with our players and with us as practitioners that we're fortunate to have this device in house that we use and we see results.
That's awesome. Yeah. I want to take a second just to mention for everyone who's watching, whether you're in a small clinic or a large facility, whether you're working with top tier athletes like Mark is, or you're working with, regular working day people, if anything that you've heard us talk about today makes you curious about potentially getting some amazing regenerative technology that's, non-invasive into your clinic, it's super simple. You can actually test drive StemWave for 60 days. You don't have to pay a thing. And after 60 days, you can assess, if you like it or not. Chances are you're going to like it. We have a 98% success rate, and we have about 600 units out in the country right now. And that's because, all the things that Mark's talking about, it shows a high level of efficacy right off the bat, and your patients are going to be extremely happy. So all you have to do, I'm putting it in the chat right now, stemwave.com. Go to the website. You can book a call with our team. There's a bunch of buttons that you can click to book the call. They're all over the website. And it'll be a conversation, kind of like what Mark and I just did, where our team is going to kind of assess whether or not, they think StemWave would be a good fit with what you have going on in your clinic. We don't work with everyone. That's because we want to make sure that it is a good fit. But like I said, 60 days, we place it in your clinic. You can test it out. Chances are that your patients are going to see really, really great results, just like Mark and I are talking about with what he's seeing with his players. So, very easy to do. Again, stemwave.com, threw it in the chat. Mark, it's been a pleasure to know you through this process. I feel like we're friends more than just colleagues now. It was really great to be at the facility and see how your team operates and be able to infuse StemWave with what you guys are already doing, and see in this first season how successful everyone was on and off the field. So again, congratulations on such an epic season. We're all really, really excited to watch leading into this next season and see how far this team can go. And knowing that whatever happens, you guys got StemWave in your corner. And, if guys do have to miss some time, it's not going to be long. They're going to be right back on the field. So again, I appreciate you for taking the time out of your schedule today to meet with us. And we got some people saying Super Bowl next year. And hey,
Yeah.
we're one game away this past year, so why not, right? Maybe it'll be sooner than we all think. So again, I appreciate you, Mark. Thank you for coming on.
Thank you. I appreciate it. And, again, thank you for your guidance through all of this, dating back to last year and, providing us the opportunity to get with StemWave and, letting us see the results that we see. And again, keep providing the best care that we can provide for our athletes. And, thank you again. And thank you to everyone at StemWave for their continued support.
Fantastic. All right. Well, have a great off season, and I'm sure you're going to be gearing up for the combine and the draft and all that stuff before you know it.
Yeah. It's always right around the corner.
Yep. All right. Well, enjoy your time off until then, and we'll talk soon.
Awesome. Thank you.
Yep.
Take
Bye.
care.